Hello, welcome to this episode of a Creative Approach podcast. I'm your host, Karen Poirier-Brode. I'm settling into summer here. I've been able to enjoy some of our lovely weather with outdoor activities. Sometimes I'm finding myself too much behind the computer screen, but even when I feel I must attend to email and other web activities, I'm trying to get outside with my iPad. I did take a hike recently with the San Francisco Bay Women's Environmental Network. It was a short walk, and I did bring up the rear. I still feel the aftermath of the experience, too, but it was worth it. Great times for female friendships and bonding, even though the hike did push my physical limitations. I like those get-togethers with folks who share my interests. Every month, a group of lady ducks gathers for a happy hour here in town. It's great to share time with them. I also have made plans to attend a Lady Gaga concert in San Francisco with my son. Cal, my partner, attended the Paul McCartney concert at Golden One Center opening a while back, but his older ears found the loud music challenging. So no worries, my son is happy to be my companion for the Lady Gaga show. That should be fun. Soon, I'll be heading to a podcast movement, a convention for podcasters. It, like most conventions, gives lots of encouragement to attendees and provides some education. Now, there's a lot of sales pitches for equipment and services as part of the mix. Some of that, though, is helpful. Of course, it's an opportunity for fun and bonding to be at the meeting. Being part of a tribe that gets you is energizing. The focus of all this work and fun is our listener, the person who loves podcasts in general, and our offerings specifically. Thanks so much for your part in this podcast adventure. And thank you for joining us today as I speak with Dr. Mary Guinan. I've often thought that much of practicing medicine is similar to detective work. Nowhere is that more true than in public health. My guest today is a renowned female medical detective and a personal hero. Show notes from today's episode, where you can learn more about Dr. Guinan, are available on the webpage, acreativeapproachpodcast.com. You'll find the show notes and links to our past shows there, too. Don't forget our Facebook page and our Facebook group page, where your show comments are welcome. Hello, everyone, and welcome to a Creative Approach podcast. I'm very excited. I'm always excited to speak to my guests, but of course, once again, someone I'm very excited to talk to today is Mary Guinan. Dr. Mary Guinan has a long career in medicine and working in public health, and I've known her for a number of years. We were both members of the American Medical Women's Association. At one time, Mary served as president of that organization, but I don't want to get into too much here because I would like to hear from Mary about her story. So good morning. Welcome.
Good morning. Thank you very much.
I know it's not morning for everybody listening, but it's morning here and morning
where I am,
where
yes.
You are. So welcome to the show. And I'm so happy to have you here. And as I was saying, you've been involved in a lot of things. And I was wondering if you could maybe help fill in this story of medicine and public health. And right now, you're retired, but not completely, because I think you're still involved in a number of things.
Yes, I am. I retired from my job as the dean of the public health school at the University of Nevada, Las Vegas in 2014, and then I became a writer. I wrote a book about public health because I felt that, and the book was geared to the general public because I feel like people, the general population, don't understand public health very much, and when they don't understand it, they don't value it. And our public health systems are breaking down in this country, less and less, and that's prevention rather than treatment. Public health is health promotion and disease prevention.
Which is far better.
Yes, which we would like to integrate into the medical system, prevention and health promotion. But it's done by the states in public health systems, which are complex and many people don't understand them. So I decided to take one job in public health, which is an epidemiologist or a medical detective, as I called it, and that people are called, and explain how I worked as a medical detective. What are the things that I did? And there are many things you can do. So my book, which is called Adventures of a Female Medical Detective.
And we'll include that in the show notes and how people can access that and buy the book, because it's very good. I've read it and enjoyed it enormously. But yes, so Adventures of a Female Medical Detective, right?
Yeah, In Pursuit of Smallpox and AIDS is the subtitle.
Two very important communicable diseases. So that's great.
And I also, the other reason I wrote the book was to try and bring more people into public health, more people into knowing what it is and how exciting a career it is. I mean, it sounds so boring and people talk about it. Even when I was in medical school, I never found it very interesting to hear about public health and how it works and what the system is, and I had to memorize things, and it never sounded exciting to me until I eventually applied for, after I graduated from medical school and finished my internship in internal medicine, I applied to the CDC, that's the Centers for Disease Control and Prevention, to the Epidemic Intelligence Service program. And that is a 2-year program where you're trained in epidemiology, in the control of the detection and control of epidemics.
Right.
And the reason I did that is that I wanted to become part of the worldwide smallpox eradication program. I read about it in one of the medical journals about this. The World Health Organization and all the countries of the world had gotten together. Imagine, there were then 165 countries, and they all agreed that they were going to eliminate smallpox from the world. And I thought, I want to be part of that. Can you imagine that happening? It really
amazing.
did.
Yeah, I mean, really.
And then when I arrived at CDC, I found out that was the way I was going to get into this program. And when I volunteered to go to India, which is where they were working on smallpox at the time, I didn't really get accepted. People thought, no, they didn't think that a woman could do this, that perhaps it was too dangerous, or being out by herself in the boondocks of India to find smallpox and try to control it. So they told me that that the WHO was not accepting women into this program when I applied. And
what year was that?
That was 1974. And it happened that Indira Gandhi was the Prime Minister of India at the time. And so I went to the head of the program, who told me that they weren't taking women. And I said, well, do you know that Indira Gandhi is the Prime Minister of India? Do you think she knows that they're banning women physicians from the United States to go to India? I said, do you think I should write directly to her, or should I write to the Indian embassy in the United States? And he said, I'll let you know. And the next week, I was accepted. So you see, there's ways of getting around. I tried to make him recognize that there was this discrimination, and it wasn't, but I didn't want to use that word, because I think the use of words is very important, and what words you use. And I said, well, I wanted to use words that would not criticize him or make him feel badly. Just say, we need to change things maybe. And he agreed, and it was changed. So I went to India, and it was really an incredible experience to be in that country and see what was happening. And I was unusual to be a foreign woman in India. In the parts of India that had smallpox were the very rural areas, which very few foreigners had contact with. And
since they hadn't been accepting women to that point, of course, even if any had come through, they weren't women.
Right. So, but my coming brought out all the women from the villages just to see me, because they had never seen a foreigner before.
And they could come out to see you because you were a woman.
Yes. And they would then, and I would be talking about, I had an interpreter. Each of us who were in the program were given a driver, a Jeep and a driver, and a paramedical assistant, Shafi, it was mine. And he was Muslim, my driver was Hindu, and the driver spoke Hindi, which I didn't do, and Shafi spoke English, Urdu, and Hindi, and I only spoke English, so we were constantly translating, talking to each other. But Shafi was my translator, but he was a man, and so when the women would invite me into their mud huts, which they lived in mud huts, he wasn't allowed to go in there. Translate. And so the women we would talk in sign language. They would be asking me questions, and then I would ask them, tell them that their children needed to be vaccinated. I would just point to the vaccination and the needle and show them what I was going to do. And then they allowed me to, and I had a group of people who helped me vaccinate. And so that I think it was really an asset, because mothers are the ones who protect their children, right? And so they were very interested, and they paid attention to what was going on, and the children would come out and get their vaccination.
And there was the real benefit of having a woman involved. And I think probably people nowadays don't realize how often we may have had to educate people that they were putting up barriers because we were women. I don't know that people really know that that's how it was, that we had to point out, but that man didn't have to do that. Why are you asking me? I think that was one of my kind of stories that I have from my time of people saying, well, you need to do this and this. And I'm going, but how come all these other men whose situations were similar to mine didn't have to do that? And it was like this, oh, really? Oh, I guess that's true. Well, yeah, maybe we should let you. But yeah, it's interesting to look back on that, and then how much of a difference that made.
Right.
That was beneficial.
And I think that's true in all of medicine.
Yeah.
Women being introduced. Women have traditionally been healers all since the beginning of time. And I think that recorded time, the beginning of recorded time, the women usually healers. So I think that it has improved medicine remarkably.
Yeah, well, that was a creative approach, perhaps, but one that made a whole lot of sense. And some fun adventures. You were saying you thought it was boring, but when in the practical sense, it didn't turn out to be like that at all.
Right. It was wonderful to go. And what we used to do is go to each of these villages, and Shafi would make an announcement and show pictures of people with smallpox and ask if anybody had seen people with this disease, smallpox. And he'd show the pictures, and we would offer, I called it a bribe, but it was a reward for anyone who could show us a case, bring us to a case. And 10 rupees was a lot of money then. 10 rupees was so that at that time, the reward was 10 rupees so that people would go and show us the case. And then when you found the case, you gave the reward in public, 10 rupees to somebody, so they knew that we were faithful and gave the money. And then what we had to do was quarantine the case and then vaccinate everyone within a 5-mile radius, because smallpox moved from person to person. And so that's what we did. We'd have a group of people, and we'd take a census of the village, and then we would find out how many children there were and make sure the children were vaccinated, because they were the most vulnerable to death. And from smallpox. And so this 5-mile radius was really very difficult. First of all, there were no maps. So how was I going to decide what the 5-mile radius were, where the marks were? We didn't have any maps. So.
And no cell phones with GPS.
No cell phones. I mean, there was no way that I could contact anybody. You're there by yourself. So it turned out there were these rivers within my area, my 5-mile radius area of one of the patients with smallpox. And there were rivers, and the rivers were too deep for the Jeep to go over. But I needed to go over there, because how did I know if it was spreading on these areas? And so I first tried getting camels. There were these camels that would come by And we would ask them to pay them to take us across the river. It was very difficult because they were carrying a whole lot of things, and they didn't want maybe something heavier on their camel, and the camels weren't happy about it either. They would turn around, recognize that I was a foreigner, or whatever, and bite me on the arm. I got bit a lot of times by camels, and then sometimes camels didn't come, and sometimes there was a boat that we could find a boatman and have him take them across. So, but I was really frustrated. I was very, very worried that the smallpox was moving all around and I wasn't there. So one day this vehicle comes down. It's a black Mercedes, and it comes down. And we were in this village vaccinating, and this young man gets out and he says, "What are you doing?" And I told him. He spoke perfect English. Said, Oh, yes. And then the whole village came out. I don't think they've ever seen a Mercedes. It was really dirty, all full of dust from the roads and covered with dust. And he said, "Yes, I heard about what's happening, that you need to get across the river." And he said, "So I'm going to help you. I'm going to give you an elephant." Well, I didn't know. I said I didn't know how an elephant would help me, But I was saying, well, I try to say thank you, but no. But he said, "Oh, and here comes the elephant." He says, and he points. He says, "I drive too fast. The elephant can't keep up with me." So on comes this elephant with this elephant driver, which is called a mahout. And he had this beautiful white robes on and a big turban with a star in it. And he's coming down the road. And of course, the people in the village had never seen such a thing. And they come down and we're all standing there. And he says, "Okay, I'm going to show you how the elephant can swim and can take you across the river and then can take you to your places and then come back at night so that you won't have any problem crossing the river." So we went to the banks of the rivers to demonstrate, and the whole village was around. Everybody watched, and I had to climb up this elephant. Elephant's pretty high, about 9 feet. The saddle would be about 9 feet high, and they had this hemp ladder that you had to climb up, and it swung back and forth. So getting there wasn't a very graceful mount in my part. Getting up there, so I got up and got on. Then Shafi, my paramedical assistant, got on, and then who was giving us the elephant, the owner, said, "Well, if the water goes over the elephant's back and you're going to get wet, the elephant is going to pick you up in its trunk." I said, "Oh, no. This is not me." So no, I'm fine if I get wet. I'm fine. I do not want to be picked up. So this caused a great deal of conversation. We had to talk to the driver and the elephant Shafi interpreting it, saying, no, I wasn't going to. And then finally, we agreed that I wouldn't be picked up by the elephant's trunk. And so that we get into the water and the elephant swims beautifully and goes over the water goes over the elephant's back, and he picks up the mahout, the driver, and holds him aloft so he doesn't get wet. We get to the other side, get up, and then we went back the other way and said, fine. And he said, okay, the elephant will be here for you until you need it. So I ended up having an elephant, and I became famous for having an elephant in the smallpox eradication program.
But the very creative solution to that problem.
And the thing is, I didn't solve it. He did.
Yeah.
I mean, this guy, and I never saw him again to be able to thank him. I had no idea where he came from.
So you didn't really know who he was?
Yes.
Oh.
And we managed to vaccinate the 5-mile radius. Took us 2 or 3 weeks. The elephant would go home every night and then come back in the morning. And so we accomplished our task. I was very excited, extremely exciting. Can you just imagine having
now,
an elephant?
Did you have to fund this, like feeding the elephant and your driver? I mean, that might have been an interesting item on your...
I didn't have to feed the elephant.
Yeah, but that must have been an interesting line item on your budget.
Yes. But the problem was what I did was I paid the elephant driver. I paid him a stipend, a weekly stipend. And that was very difficult to explain. And that's how everyone at WHO found out I had an elephant, because it would be in my expense report.
Right.
That I go. And the director of the program would call me the elephant lady.
But it solved that problem. That was great.
Yes.
And so how long, you spent a number of years at the CDC then.
Yes. I worked at the CDC for some 24 years. I finished the epidemic intelligence training. Mm-hmm. And then I left and decided that I was going to be an infectious diseases specialist, because the whole small-pox eradication program got me interested in that.
Oh, sure.
And so I got training in infectious diseases at the University of Utah, where I studied herpes viruses. And herpes viruses, one of the herpes viruses is a sexually transmitted disease. And I became somewhat of an expert in doing some studies on women with genital herpes infection, because women with genital herpes, there was no treatment for it at the time, even though it would come and go. But for pregnant women, if they passed it on during delivery, the herpes virus would kill the baby for the most part, or leave it substantially harmed, so that it would just be. So women were afraid of getting pregnant who had this. So I started doing some studies, and I looked up the literature, and there's no information whatsoever on women and herpes infection and what to do and how to do it. So I did a study on the natural history of herpes simplex and genital herpes simplex infection in women. It was published in the New England Journal of Medicine, and which is a very good journal.
Mm-hmm. Very
and prestigious. Yes. And I became since I was the only one that had any data, I became the United States expert in herpes, genital herpes infection. So I was recruited back to the CDC as their herpes expert. And then I was recruited back to what was called then the Venereal Disease Control Division. Can you imagine?
Yeah.
When anyone asked me where I worked, I would say venereal disease. They take 2 steps backwards, you know. You don't get it that way. You don't get it that way.
Yeah, language is very interesting.
Yes, changing those words. We worked very hard in changing that. It became sexually transmitted diseases then, as you know.
Yeah.
It was a shameful thing, so people didn't want to have it, and so would hide it. And so this is not a good thing when you're trying to control prevent disease spread. So trying to make sexually transmitted disease not something shameful, but just another medical problem that had to be solved.
Right.
It's still that way. It's still that way.
It's
still that way.
Well, there's so many cultural things that play in that. Whereas, as medical professionals, we can sometimes step back and get objective about it and say, but it's a disease and you have to manage a disease. But there are so many other things that play into this for people, their response.
Yes, and it's like leprosy. People who get leprosy, it's from the Bible.
Right.
Lepers were kept out,
Exactly.
So that has, and still continues to this day.
Right.
And I saw a number of leprosy cases in India when I was there. It was very, there was still a problem in India.
Uh-huh.
But anyway, I became a woman working in sexually transmitted diseases, which was extremely unusual. There were no women working in this area.
So you're a pioneer once again.
Well, inadvertently.
Yeah, exactly.
But it was because I was interested in women's health, and I found out that, reading the literature, very, very few studies were on women and sexually transmitted diseases. They were all done on men.
Right.
And so there was no data. There were no data on. So we had to start doing studies on women. And so had their response to drugs. And usually, for example, many sexually transmitted diseases during pregnancy can harm the fetus. So it's really important to make sure women were screened for these women who are pregnant were screened for these diseases,
Right.
and they could be treated.
And
Syphilis
prevent the
gonorrhea
problem. Yeah.
could be treated before the baby was born, and there'd be no problem with the child if the mother's disease was treated.
Exactly.
Or especially early in pregnancy. So
Right.
that's what I did. And I decided that I was just going to work on women and sexually transmitted diseases.
But it didn't turn out to be that way.
Yeah. So then what happened was, so I was there in 70, I guess it was about 78 or 79. I came back, I went back to CDC, the Venereal Disease Control Division, and I was a virologist. So then I had been trained in virology, and I was one of the few people who had training in virology then. Then we had this new disease popping up, which was eventually called AIDS, but this new disease where young men were dying of, and nobody could understand what it was. It looked like the immune system was harmed, and we knew it was happening because we would get calls asking for help. Usually the patients were gay men, and they say, is there a new disease going around? And finally, Michael Gottlieb from UCLA sent us a paper at CDC describing this new disease in 5 gay men, 2 of whom had died. So, I mean, usually people didn't die of sexually transmitted diseases. So for this to be, it was like very, very difficult. So I was part of the first task force to investigate the first cases of AIDS because of my background in virology. And we suspected that the cause of this disease was AIDS. And in fact, many of the patients who had what we now call AIDS had herpes infections, different kinds of herpes infections. And so that's why I was brought into it, because the first thought was maybe it's a herpes virus or a new herpes virus causing this disease that's killing people, actually. So that's why I became part of it. And then eventually a virus was found. After the investigation, the first investigations I did, the first case control study, which we do, that's what you do to try and find out what the risk factors are for the disease. And this is what epidemiologists do. I went to San Francisco, which is where a large number of the patients were at the time. And we did a study in 5 cities. I went to San Francisco of those that had AIDS and those gay men who had AIDS and those that didn't have AIDS, and find out what the difference was in their behavior and what they did, what they were exposed to. And it became clear that the greatest risk factor for having AIDS in gay men was the number of sex partners you had. So that was not acceptable news to people who felt that they should be able to have lots of partners without any problem. So it was not accepted well that this was, something that could kill you.
Yeah.
Something that could kill you from having.
That was a whole new idea and not a very easy one to face.
Yeah, to accept. So,
yeah.
So it ended up, it was a sexually transmitted disease, and that was the primary, but then you could get it other ways too.
Sure.
Through
blood.
Needles and drug users, exchange of needles, reusing needles, and it could be done by blood transfusions and blood products. And then we found that people with hemophilia were infected from their blood transfusions or a blood product transfusion. So it turned out there were just lots and lots of other risk factors. And we're still in our epidemic today. We still have 40,000 new cases of HIV infection, which is the virus that causes AIDS in the United States, and it hasn't decreased. So, one of the reasons why it's not under control is we don't have a vaccine.
Right.
There is no vaccine. And there's treatment, but no vaccine and no cure. So this is still a gigantic problem.
And I don't think there's really not that much money that's going into development of a vaccine. I mean, there's a lot of approaches to managing the disease and
drugs to treat the disease.
And drugs to treat the disease, but not to prevention. And of course, as a public health person, but as me as a physician, it's very bothersome that we just are not investing in trying to actually prevent this. It's very frustrating.
Yes, it is. I think that, and I think one of the reasons that there hasn't been the wholehearted investment is that people still feel that these are people who deserve it. They deserve it. They're having sex partners or they're using drugs, and therefore, they're people that we shouldn't be investing the government's money in helping these people. This is a constant problem.
Yeah, and that, even for those people who have some moral outrage, the fact that they can't have concern about what they would call innocent victims who, there always are.
Right.
So even there, even if you took that moral stance, think of all those other people that you would not condemn that are being hurt by this, by not having this. And yet,
right.
I don't think, when it comes to disease, morality just doesn't seem like a very good position to take as a healthcare provider. That's my feeling. But on the other hand, even for these people who take this moral stance, it baffles me to think that they'll just accept all these people that they would otherwise consider as innocent are getting damaged by the problem,
right,
and not addressing a way to prevent this disease.
Right.
Yeah. Well, AIDS is an interesting and, figuring it out, interesting. And I wanted to ask, because not many of us have been portrayed in movies. And of course, in the movie And the Band Played On, which is about just figuring out what was going on as far as AIDS. And it's an old classic movie, but Mary is portrayed in that. So how does it feel to have an actress portraying you in your real life?
Well,
that's a question I have.
It was really interesting. The movie was made by HBO, which is HBO is in Atlanta. Headquarters are in Atlanta, Georgia, where the CDC is. And when the movie came out, HBO invited all the people from CDC to see it. And I was not in town. So when I came back, people said, "Oh, you're not going to like it. It's just not you in there." And I never saw it, and I didn't see it. And finally, it was being shown on, and so I invited people to my house, and I got HBO. I didn't have a subscription to HBO, but I got it so we could, and so he watched it, and it really wasn't too bad. It certainly didn't make me look bad, but the thing is that it had me sort of being like a really nice person.
Well, that's not necessarily bad, and I wouldn't say that's totally against your character.
But not a scientist, doing science.
Right. Were you fetching coffee or something? I can't remember the movie.
I'm making cake.
You're making cake. Oh, dear.
I made a cake for someone, That's what woman scientists would do in this episode.
I figured.
but if you look back now, in retrospect, at all of the women who were involved, and they are portrayed in there. Françoise Barré-Sinoussi, who discovered the AIDS virus and got the Nobel Prize for finding the virus that causes AIDS, the human immunodeficiency virus. She's portrayed in there too, like a very nice, pretty woman sitting at the desk while all the guys are doing the stuff,
Yeah, they're in the lab and doing the heavy-duty research.
They're doing all the studies.
Yeah.
And she was the one who did it,
And you were out there doing the legwork and doing the interviews and drawing blood, and yet you're portrayed with cake. Oh, dear.
But it didn't mind. I wasn't bad. You know what I mean? I wasn't a bad guy. I wasn't portrayed as a bad guy.
You as a really nasty
it wasn't bad for me. I didn't feel that, that it wasn't, because I was so used to that women weren't recognized, and say, "Oh, yeah." And the people say, "Oh, I say it's not so bad," but I saw it once and I never wanted to see it again.
But
never wanted to see the movie. It's just so uncomfortable watching somebody that's supposed to be you. Not that she was bad. I think she's a good actress. In fact, she died just a few months ago.
Oh.
Very young,
Yeah.
Glenn Headley. Yeah. And she actually called me and asked me a number of questions
Oh, really?
about what I would do in certain situations. And I think she's a good actress, but it was the role that was written for her.
And that's how women were portrayed, and there still are stereotypes in movies.
Right. So, but that one, if you ever look at it again, just see how the women are portrayed.
Right.
Except for Lily Tomlin. Lily Tomlin played the San Francisco health officer. And she did a great job. And it was wonderful. The people who were in the show often did it free or for, they got people to do things, essentially volunteer their services. And
just to get out word, because I think a lot of people still didn't understand or know much. I mean, not that a lot of people know a lot about medical problems anyways, even nowadays, but I think back then there were a whole lot of questions about what exactly happened. So
yeah, and the band played on. I think this next year will be the 40th anniversary of its publication, and they're republishing the book, a new edition of And the Band Played On. But I think they need a new addition to the movie because so many things have happened since then. Most people haven't read the book because it's 600 pages and,
exactly.
full of technical stuff. And so the movie is wonderful in telling the story, in making people aware of what was going on in those days and how terrible it was, how difficult it was for the gay men. The stories were just horrifying, what happened to what were being done to gay men. And I think that it still is. It's still being shown. That movie goes around as being shown in schools of public health as a usual to show what happened. But it's only up to 1987 when it was published. So
and a lot has happened
all the
since
things
then.
that happened since then. I think we need a new movie to give credit to all of the people who really deserve the credit.
And maybe with a little slant to emphasize that maybe we should be looking at prevention of this problem. But
right.
And
show the status of it now.
Yeah,
I mean, we've lost control of it. It's not.
Yeah.
It's not under control, the epidemic.
Exactly. No, I mean, not to say that there isn't great work at helping people with the problem, but that just is not really the answer. And so, those are two of your main areas at the CDC, but after the CDC, you still were working in public health.
Yes, yeah. I left CDC and changed my sort of career to, I became the state health officer for the state of Nevada. And working in states in public health is so much different. I mean, I used to think, that CDC was the place to be, and that's where public health was. And CDC had, but it turns out that the states are really the people who do all the public health work. And the people who work in these states are epidemiologists and biostatisticians and behavioral health workers. All of them work in your state in the public health departments. And most people have no idea what their public health departments do. I mean, I ask people all the time, do you know what your public health department does? It says, it gives vaccines for school or something, People have no idea what it's doing because they usually never hear about the health department unless there's a problem. If there's an outbreak and all of a sudden, all these people in the background surface. And so I worked as the state health officer and I had numerous issues that went on. There was a cluster of leukemia in a small town in rural Nevada that was just horrifying.
Yeah.
Kept just having cases of it and we really did big investigations, but never really found out what happened. And I'm writing my second book and I hope to include a chapter on this leukemia cluster in children. And so then I was recruited down to the University of Nevada, Las Vegas to found a School of Public Health. And I said, well, that I would do it for a year. I was living up north in Nevada, which is 500 miles away from Las Vegas. I said I would do it for a year. I ended up staying 10 years.
And yet another pioneer position.
And so what I did, what's going to happen, which is really very, very exciting for me, is that I went down there like in 2005, and then 2007 was the recession, and Nevada was particularly badly hit by that. I had to cut the faculty, and we did not get back on course again for several years. So it took much longer than expected to try and get an accredited school of public health, but we have just filed for accreditation for the School of Public Health, which we hope will be awarded next year in 2018.
Oh, wonderful. That's fantastic. Very good. And then, so very busy with establishing that, I'm sure. And then, but even with retirement, you're pursuing public health interests.
Yes, but I've always been interested in women's health and the women's side of things, even in AIDS. I wrote, everyone said, women can't get it. So if anyone understood sexually transmitted diseases, there's no sexually transmitted diseases that only in one sex,
Right.
So I then studied AIDS in women, and I did the first study on AIDS in women in the United States, and I continued to, women could then could infect if they were pregnant, they could infect their children. That's one way that the virus is transmitted during delivery. It is so, but now it can be prevented. So we have that. So neonatal herpes, which was a big problem, is now practically eliminated in the United States because there is a treatment. But you have to make sure that the women are tested for HIV.
Oh, yeah. Well, you said herpes, but actually herpes and HIV. Yeah.
I'm sorry. It was HIV. Mm-hmm. Tested for HIV. So I think that, I continued my interest, and you mentioned the American Medical Women's Association. Well, I believe that it's extremely important to a women's organization to promote women's health. Look what's happening now in the Congress, and trying to, even in the deliberations of repeal of the Affordable Care Act, they were trying to decide whether they were going to cover pregnancy.
Right. And it was all men deciding this too.
13 men, no women that were called. So I believe that there are always differences of opinion on various things. And on women's reproductive health, we have to understand that women need to be in charge of their own health. But it's the lawmakers and it's the states that decide whether birth control will be available or contraception is available and for all women. We have 49% of all pregnancies in the United States are unplanned. And the CDC recommends that we have to reduce the numbers of unplanned pregnancies. But they don't recommend that all women have access to contraceptives because the CDC is not really allowed to talk about birth control and contraception. So I have criticized the CDC, saying you really need to know the best way to prevent abortion is to make birth control contraception available for all women.
And then we were talking about birth control and contraception, and I think the listener might say, well, I didn't really understand until you pointed out to me that a lot of people in the country, physicians, I think of birth control as contraception, but for the public, sometimes birth control becomes, in their thoughts, is abortion. And that isn't really how, so I think sometimes the words we use, we were talking about that earlier, are important.
Right. And I was introduced to the word LARC, which is long-acting reversible contraceptives. And LARCs are extremely effective and 100% effective in preventing pregnancy. So if we essentially said to all women in the United States, of course the states are in control of these of health. If all the women who didn't want to get pregnant could have access to a LARC, a reversible contraceptive, so when they were ready to have it, then this can be reversed, say, oh yes, then we could reduce the number of unplanned pregnancies. And all studies have shown that we can prevent abortion by providing birth control, prevention, but we can't when you say birth control, people think that's abortion. So I've tried to change the word that I use. I use LARC. And I'm introducing the concept that it's a long-acting, it's not a sterilization, it's reversible, and it's almost 100% effective. Pills, birth control pills and condoms, they're very ineffective because of the lack of use. And so and condoms are in control of men, not women. They're very ineffective because they're not used.
Right. And even when you use things perfectly, there are circumstances
they
where the pill doesn't work, condoms can break, they're not perfect.
Right.
But a LARC is, not
almost 100%. Now, LARC includes IUDs. LARC will include IUDs, implants, various injections, 3-month injections. So there are a number of different kinds of LARCs.
Right.
So the woman could choose, but it's a long-acting. You don't have to think about it. You don't have to take pills every day. You don't have to worry that all of a sudden, if you're in a situation where you would have sexual encounter, that you're safe.
Yeah, and it's reversible, and
yes.
So when you want to be pregnant, you can be pregnant, and yet it's very, very effective and pretty darn close to 100%.
Right. The problem is it is expensive. They're expensive, more expensive than pills and condoms. But in the long run, prevention of contraception of unplanned pregnancies are very cost effective because they're so good at preventing unplanned pregnancies. So I think that the cost factor is used as why we're not going to offer women these. I think the cost is now, we're having right now this terrible epidemic, heroin and opioid epidemic, and women are very much victims of this, or unfortunately, and they're having babies because they're not going to protect themselves from if they're addicted.
They're too preoccupied with their addiction to even think about preventing pregnancy. And yet the babies are so damaged.
Yes. And the number of drug-addicted babies being born has quadrupled in just 1 decade. Quadrupled in 1 decade.
That's a startling statistic.
All drug-addicted women of childbearing age should be offered a LARC to prevent unplanned pregnancies and addicted babies. And we could prevent it. I am sure that the majority of addicted women, if offered a LARC, would take it because they're not interested in having babies. And the cost of treating addicted baby is hundreds of thousands of dollars. It's just frightening. So if we could prevent these addicted babies by preventing unplanned pregnancies, it would be very cost effective in the long run.
Well, there's where the cost of LARC just becomes insignificant in comparison to if you're just looking at the money side of things, not to mention the human tragedy, the cost is minuscule compared to all of that.
Right. And for Zika virus, when the Zika virus outbreak came in Brazil, they're telling women not to get pregnant because the worst outcome of Zika virus infection is affected fetus, in which the fetus is very badly damaged and children are born with very, very bad birth defects. So to prevent the pregnancy, they say, well, maybe you shouldn't get pregnant because, the mosquitoes are biting you and you might get bitten by the virus. But they did not provide them birth control. There was no birth control available. So to say, well, don't get pregnant, but you don't, it was ridiculous. It was so bad. It really made me very angry that there was no prevention whatsoever of pregnancies. And they focused on, well, if you do get pregnant, then let's find out whether you were bitten by the Zika virus. Well, then the damage is already done. So here in the United States, same thing happened. No contraception was offered for women who didn't want to get pregnant. If in Florida, they defunded Planned Parenthood. And that's where many of the cases were. The Zika virus cases in Florida still are in Florida. And saying that, okay, women don't have anywhere to go to get contraception once the women who do not have insurance and who don't have the means to go to other doctors. These are poor women who are going to be the most affected. And they're not being offered a lark. They should be ordered lark. People giving them condoms. Are you kidding me?
Yeah, I mean, it just doesn't
I
work
think
to
it's
prevent
true.
that disease. Yeah.
And so for prevention of the birth defects, it doesn't prevent Zika virus infection, but it prevents the worst outcome of Zika virus infection with these tremendously
preventing the
children.
outcome of harmed babies from Zika or opioids or whatever.
Right.
Long-acting reversible contraception really can make a lot of sense. And I think there's a whole lot of women's health care issues that do need to be addressed, and it would be helpful if we had women helping make these decisions. But I think that's something that we as the public can take on as a responsibility of making sure these, at least we can't make those decisions necessarily, but we can vote for people who will and
right.
Call
and get
right
women into office who understand that. Look how effective 2 women were in avoiding the repeal of the Affordable Care Act and taking millions of women off of birth control, contraception, and health care in general.
Kind of health. Well, if you want a healthy nation, you can't not have people covered by some kind of insurance in great numbers. And, I'm all for covering everybody and really addressing public health and preventing illness, which is probably one of the best ways to save money and to have a healthier population.
Mm-hmm.
I think that's very important. Now, all of this work that you dedicate yourself to, is this something that just came out of, like, you went to school and you just enjoyed science and went into that? I mean, did you have people who influenced you in your life? Where's your origins, and were your family or friends influential, and what pushed you into this direction?
I am a daughter of immigrants, of Irish immigrants. My parents immigrated from Ireland and settled in New York City, and that's where I was born, in the middle of 5 children. And my parents, who brought the American dream, they met actually on the ship coming from Ireland to the States, and they eventually got married. And they believed in the American dream, and they told us we were all going to college. How we ever were going to college, we didn't know. My father worked in the subway system. My mother stayed home, and then my father died suddenly when I was a teenager. And we weren't sure what was going to happen. So I went to work. I worked through high school and college, and I couldn't afford to go to college, except that New York City, the Hunter College where I went to school, was a city college which was free. It was free if you were accepted, and I was a good student, so I was accepted there. I never would have gone to college. It was free. It was not only free in New York City. This is a city system, not a state system. City system. It was not only free, but every semester you paid $20 for the rental of the books you needed for every course you wanted. So that I had and then I worked. I worked in Bloomingdale's, which was a department store, and did all sorts of work so that I'd have money to get to school and back. I rode the subway to go from Brooklyn, where I lived, to Manhattan, where Hunter was. So while I was there, I never dreamed of being a scientist. But Hunter had been, before I got there, a college for women. And it was established during the Depression to try and train women for jobs, mostly teaching jobs, so they could support themselves through Depression. But then when it was thought discriminatory to have only women's schools, it was changed so that it was integrated. But because it had the reputation of being Hunter College for Women, there weren't very men at this school. So when I went, there were very few men there. And I took my first chemistry course, and I apparently, I didn't think anything about it was required. And at the end of the semester, after I took the final exam, my professor asked if he could see me in his office. So I went into the office, and he said, well, you've done well in your exam, and I wonder if you would consider majoring in chemistry. I almost fell over. I said,
so your science was a surprise to you.
Yes, right. I said, well, I don't know. I said, I'm good at taking tests. It's just a fluke. I told him it was just a fluke.
No.
And he said, well, how about if you take the next semester and see how you do? And I did well, and I became a chemistry major. So that was really wonderful. I loved it. I loved science. And then, it was a shock to my family. Nobody in my family was a scientist. But I had always wanted to be a doctor. I don't know why. People would ask me why. And I think it was because there was actually on my street in Brooklyn, many doctors. They used to, work in the brownstone houses, and there was a woman doctor. Actually.
So
and
there was
she actually had the nicest house.
And you said, not bad.
But I never saw her. I saw her, but I didn't know her or thought,
right.
But at least I had in my head that you could be a doctor, right?
Right, yeah.
There was one doctor. One woman doctor, and there were 5 or 6 male doctors. So when people would ask me what you want to be, I said, well, I want to be a doctor. And they said, well, what else? And I said, either a doctor or a plumber. I somehow thought plumbers might be.
Why a plumber?
Yeah, I don't know. Maybe I thought that was somebody that was really helpful. You could really help people.
Well, that's for sure. A lot of emergencies in plumbing.
But then in those days, you really had to pay to get into medical school, and women were restricted, and you had to show that you had the money to pay tuition. There were no factors, so I just didn't. I tried to get a job, and I had a tough time getting a job when I graduated from Hunter because there weren't any jobs for women chemists in New York. There were segregated want ads. Some help wanted men and help wanted women, and there was never a job for a women chemist. So I finally ended up in a chewing gum factory as a flavor chemist.
Okay.
There, and I was making new flavors of chewing gum, and it was in 1963, and I was in my lab working, and someone walked in and said to me, the president has been shot. And I said, what president? He said, the president of the United States. And I was shocked as anyone could be, remembered where I was at that time. The president had said in his inauguration, ask not what you can do, what your country can do for you, but what you can do for your country. And he had inaugurated this space program to put people in space. So I decided I was going to try and be an astronaut. I just was not going to sit there making
flavors for
chewing gum. And so I applied to the University of Texas in Galveston, which is just a few miles away from where the NASA program was. And I was accepted there and got a scholarship. And I didn't tell anybody. People wondered why I would come from New York City to Texas. They figured I wanted to find a Texas millionaire, I think. But, that's a tough way to do it, going to graduate school.
Yeah, it does seem. But
so
anyways.
I took aviation and space medicine, and it was really a wonderful experience. And I had a mentor then who I eventually told after 2 years that I wanted to be an astronaut. And he said, well, just wait. He said, wait until you graduate and show what you can do before you tell people, because he thought I would be laughed at, and I certainly. Yeah. And so
could have been back then, yeah.
Yeah, and it as it turned out, when I graduated just as the space in '69. Just when the first man went on the moon, which is wonderful. Anyway, I knew that I wasn't going to be accepted in the program because they didn't accept women as astronauts until some years later. And even if they did, it was so competitive that I didn't. So I went and did a postdoctoral fellowship at the National Institutes of Health on what I was working on, which was blood coagulation. I was very interested in that. And there was a problem in space. Everybody was wondering what would happen with lack of gravity. Would the blood be coagulating? So I did some studies related to aviation and space medicine. And then I went to the National Institutes of Health, and I tried to find a job. I was there, and they said to me, "Oh, we can't accept you here unless you have an MD." We don't accept PhDs, PhDs, and there were a glut of PhDs on the market then because NASA had asked for scientists in the space program, and they provided then stipends for scientists, although I received a stipend from the University of Texas. So there were more and more people, scientists, who were now available to get jobs, and I couldn't find a job. So I finally decided, I talked to one person I worked for, and he said, why don't you just apply to medical school and do this? He says, you're not going to get anywhere here unless you. So I applied to two. I was in Maryland. I applied to the University of Maryland and Johns Hopkins. I was rejected at the University of Maryland and accepted at Johns Hopkins. And I don't know why. I was really surprised, as you can imagine, because Hopkins was one of the schools that was very difficult to get into. And then, why would I? And then I found out why. After it was because of a woman named Mary Elizabeth Garrett. Johns Hopkins, when he left the money for the Johns Hopkins University Medical School and hospital, left a lot of money, but he didn't leave enough. And in about 1898, they didn't have enough to open the hospital, enough money. So they were asking people for money, for donations, and they asked Mary Elizabeth Garrett. She was the daughter, unmarried daughter of the head of the B&O Railroad. And he was dead and had left her money. She had money, and they asked her if she would donate the money to open Johns Hopkins Hospital and Medical School. And she said yes, she would, but the agreement had to be that they had to admit women on an equal basis to men. And they said, nothing doing, we're not doing it. But they couldn't get the money from anywhere else. So a year later, they went back to her, and they agreed to accept women on an equal basis. But equal at that time was 10%. And so I was so her name was Mary Elizabeth, and that's my name too.
Oh, yes.
Mary Elizabeth Guinan, she's Mary Elizabeth Garrett. So I felt that she was the reason that I got into medical school.
And what year was that?
That was 1969. I graduated in 1972. And that's when that's when
I went to medical school.
Title IX was passed. Title IX was passed. But in my class of 110 students, there were 11 women.
Yeah.
Just 10%. Exactly.
I think, when I went to McGill, it was clearly quotas, because I think we had, 20 women, 20 French Canadians, 20 Americans, 20 foreigners who weren't, that were not Americans. Those like 27-year med
in the 20 women quota? So you were one of
I was in the 20 women, 20 French Canadians, and 20 7-year med. I fit 3 quotas, so I was there. But my 19 fellow French Canadian students ganged up on me and told me I needed to learn French, which I've never done very well with. I learned some. I've taken some classes even since I've even left Canada, but it was pretty funny that we had this quota, and I think it was 20. I can't remember, but I think it was
You did get in a quota, and I got in. I was rejected from the University of Maryland because there were no quotas, and there were no quotas for women. And I mean, they had to. They had to. But equal was 10%, but now it's, equal.
Yeah.
She was this incredible woman who made my career possible.
Well, that's wonderful. And then, of course, you've told us how you went on in the rest of your career and have done such significant work and have done, been a pioneer in a lot of things, have been a creator, and you're an author and working on another book. So since the show is a lot about creativity, I was wondering if you had any thoughts here about creativity that you wanted to transmit to the listener.
Well, I think that one of the things that I want to be creative about is language, because now with all of the fake news and things, you have no idea what the words mean. Words are changed, and that's one of the reasons that I'm promoting LARCs instead of birth control, because I believe that it tells exactly and explains to the reader exactly what that word means. And because you always are going to have people who are opposed to you and will try to to change the meanings of the words. So you have to be creating and doing something. Someone told me one time and said, Mary, if you want to make people understand, French people understand what you're saying, you have to speak French. So the idea is you have to speak the language of the people that you're trying to get to and educate them about how this language, and in a way that's not overly very, where you're not preaching to the choir, but you're enlightening people about their lives and how these words mean things. And then I'm hoping that I can convince people that since the history of the world, there's always people who are for and against things. That's what causes wars and changes. And I think men and women, there'll always be people who do not want women to be in regular jobs doing the things that they want to do. And there are always people who are opposed to contraception. So that you have to understand what their words mean. They're often they don't speak in certain ways. They speak in words that make you think differently. So I would like to make it clearer how women need to prepare themselves to be able to have what they want in the future and not vote for people who are interested in promoting equality of women, and especially women's health. Women's health actually depends on your states. The state controls women's health, so that you should be concerned about your states and how they have healthcare access for women, because that's where the power is. And then if the laws are bad, how are they going to change? So hopefully I will be able to create something that's understandable and readable and helps people helps women make good choices about the future.
Well, thank you. I appreciate those thoughts, and I appreciate talking to you. It's just always fun it's always a delight to talk to you, and I have really enjoyed this conversation today, and I know the listener will enjoy it as well. And thanks so much for joining me.
Thank you so much for inviting me.
Thanks so much for listening to a Creative Approach podcast today. I hope you'll subscribe to the podcast on iTunes or Stitcher if you've not already done so. Please check our A Creative Approach podcast Facebook page, where I keep you up to date on our latest episodes. I'd love you to become a member of the Creative Approach podcast Facebook group, where you can share your thoughts and where you'll find additional news posted. Also, check out the website, www.acreativeapproach.com. My team and I are working on developing a great home for fans of the show. At the site, you'll find a resources tab where some of my favorite products are listed. I may receive some income from affiliate memberships on those products. Be assured these are brands and products I use and love. The website also features a Patreon page tab for those who want to offer some monetary support for the show. Thanks to my Patreon members for their support of the show. I'll talk to you again on the next episode, and sign off today with best wishes in your creative approach to life.